Clinical governance is a systematic approach to maintaining and improving the quality of care and support that we provide to participants who use Enable for their support and therapy services. It's working in a collaborative way with all stakeholders and departments within the organisation to ensure that we can continue to provide high quality care and identify any areas for improvement and continually review our policies and practices.
David, our CEO, offered the opportunity for us to take part in the clinical governance course. I was really excited by this and jumped at the chance. The course was delivered online as a series of 3 separate workshops.
There were numerous attendees from different sectors, so whether it was a healthcare setting, mental health, or other disability sectors as well.
I loved that we were able to collaborate with other professionals across the health and disability industry. It was really great to work with them in groups, to hear of their experiences and learn from them.
It's all around ensuring that we've got robust systems in place to maintain that high standard of care, but also being able to identify when things go wrong or if we do need to make some areas of improvement to ensure that we can mitigate the risk.
The training really gave us a lot of tools to particularly use with risk assessment, and it highlighted for me that we need to place a big emphasis on assessing psychological risk just as much as we do assess physical and environmental risks.
We were provided with information around a number of tools that can be used for that. So a particular one is the 5 whys. And if an incident has occurred, you want to get to the root cause of that incident. And once we have established that root cause, we can then start to work towards putting in practices to mitigate that incident occurring again. So it could be that we've had some physical aggression towards a staff member from a participant, and we need to understand why that incident has occurred. So that's where we will collaborate with the participant themselves. We will look at the environment that the incident has taken place, and we'll look at the information that's been provided to the individuals who were involved in that incident to then identify any training needs that we may need to provide to those staff members, or if we do need to access any further services for that participant to ensure that they're safe and they are in receipt of high quality supports.
Having done the course has really opened my mind and taught me quite a lot, which has changed my practice and therefore will change the outcomes and benefits for our clients.
The key takeaways from the sessions was all around the leadership and how we can promote that clinical governance across the staff that we line manage or we interact with on a daily basis.
We now have a lot more high intensity clients. We're providing a lot more high intensity daily activity support to our clients, and having the clinical governance knowledge is really beneficial for those clients and the support teams and guiding them to give the best possible care.